Good afternoon. My name is Logan Herring, and I am the CEO of Riverside, Kingswood Community Center, and the Warehouse. Welcome to the first installment of our virtual Lunch and Learn series. We usually do this Lunch and Learn in person at Kingswood Community Center with a whole host of stakeholders from around the city, county, and the region. But as we are in the pandemic, we had to switch it up a little bit. Today, we'll be talking about the inequities that persist in low-income neighborhoods, particularly communities of color, how those inequities started in the first place and how those inequities are magnifying during times like today. One thing we want to offer up are solutions to those inequities, and we'll talk about that last. I have two special guests. One, Dr. Michele Shorter-Pope, Director of Community Engagement at Nemours, and Rita Landgraf, the Director of Partnerships for Healthy Communities from University of Delaware. So first up, we have Rita Landgraf. Sit back, relax, grab a bite to eat, and welcome to the show, Rita.
Thank you, Logan.
And you are the first guest of our Lunch and Learn. So I gave an introduction of your title at University of Delaware, but I know you're serving in an additional role during this pandemic. And then I think many people don't know that you are a Reach Riverside board member, and you serve as the chair of our Racial Equity and Advocacy Committee. So I think the topic for today falls squarely in every single thing that you do on a daily basis from a professional aspect. So first question I have for you is, what is that additional role that you're doing within the state, and some of the ways that you're using that role to address the inequities that persist within our communities around the state?
Well, I'm very honored to be deployed back at the Department of Health and Social Services to help at this most critical time of COVID-19. I've been there now for about a month addressing the activation and outreach for our homeless community and, really seeing the impact for those who have the highest level of vulnerability for COVID-19. But I'm also seeing, not only here in Delaware, but across the nation, how inequities have impacted populations, and largely those populations who have been disenfranchised, inclusive of our Black and Brown communities, as well as the homeless population. So I think, Logan, when I think about our work at Reach Riverside and how we talked about the impact of health inequities along with health disparities, which represents the burden of disease, and those populations, because of these inequities, largely due to structural racism, we really can see this as this pandemic has impacted not only the world, but in particular impacted the United States.
Yeah, and you touched on everything that I wanted to talk about today. That's why I love you. So when you see what's happening and what you were able to offer as perhaps some solutions with the homeless population, how can you see some of those tactics, the philosophies in addressing the homeless population, and how we might transition those solutions into some of the other more vulnerable communities, such as low-income neighborhoods, particularly the neighborhood in which we serve, which is Riverside community and a broader Northeast Wilmington and all of Wilmington, rather.
Well, I've learned a lot through the homeless activation, and really focusing on, you have to meet communities where they are. You have to really better understand that level of vulnerability and where that comes from. And really what we did, so I've been activated now for about a month working with the homeless communities, and what we brought forward was a model where we integrated the medical side with the social service side. As Governor Carney and the other governors across the U.S. were looking at restricting, and that's where we come up with sheltering in place. Of course, the homeless, their place is out in the open. They don't have homes to shelter in, and even being in night shelters made them more vulnerable due to the closeness. They can't necessarily do that social or distancing as well as we might be able to do. So really worked with a medical team as well as a social service team. And the state is actually incorporating that model through other communities like a Reach Riverside. I know Christiana Care is going to be activating, at Kingswood Community Center to bring the opportunity for screening, and when people are symptomatic, testing and better understanding, not only for that individual's care, but what we're seeing in the Reach Riverside geography relative to the prominence of viral activity. I also became vastly aware that like the homeless, isolation, if indeed someone is impacted by the virus, and how do they isolate? So that's when we formed partnerships with hotels, learning that, one of Governor Carney's orders was that, that you couldn't lodge in hotels in the normal sense of things, but indeed it provided an opportunity for hotels to open their doors to be more like a shelter for our most vulnerable populations. Very concerned about also how does that branch out into other communities. We know that not everyone may have a home or a dwelling where isolating in place is available to them. Some people may be living in multi-generational homes where there could be a multiple families living together. They might not have their own bedroom that they can isolate, or they may be using a common bathroom. And that too then can be problematic from an isolation and a quarantine perspective. So when I thought about what was happening with the homeless activation, I also thought about how can that be extended to the most vulnerable of our communities, and ensuring not only that people get the opportunity for screening and when appropriate testing. I don't know if you remember, Logan, but originally when screening and testing became available to the public, it was available only to people who had a health provider. And an identified health provider. Well, that left out a lot of the population, similar to homeless, usually don't have a health provider. And sometimes, individuals in our most vulnerable communities might not have access to a health provider. Again, that's an inequity. We also know that people who live in communities that have been impacted by inequities also have a higher level of health disparities. That's what I get back to. The burden of disease, chronic disease, is more prominent in communities that have lived with health inequities. We know COVID-19 is much more impactful for individuals who have chronic diseases, individuals who have asthma. We know, that in our urban environments, healthy homes is sometimes an issue for individuals relative to the toxicity that might be in the ground, in the home. So of course, there is a higher level of vulnerability from a health perspective. And this COVID-19, actually, the acuity of it impacts those who already had this level of health disparity. I think that's why you're seeing, the numbers relative to Black and Brown people and the impact of COVID-19 when individuals of color are impacted by that viral activity. So all those things, just come into play and really shine the light once again on the social determinants of health, where we live, where we work, where we pray, where we play, and the inequities that are still prevalent in our country. COVID-19 is now shining a brighter light on these inequities.
One thing I want to get back to is one of the statements you made earlier about the structural racism, the systemic racism that has really caused these vulnerabilities in our neighborhoods and in our communities. And at Reach Riverside, our mission is to eliminate the barriers of structural racism. And now more than ever, you see a lot of those barriers come into play. Having to have a primary care doctor to refer you to the screening and testing, which is why we have made screening and testing available at Kingswood Community Center in partnership with Christiana Care. I know you're a part of that partnership as well, to make sure if folks, after they get screened or tested, and they need quarantining, to be able to provide that access to that. I think about, the barrier to primary care. Even if people do have primary care, but they might not have transportation, now you're forcing them to take public transportation. So we're wrapping up. We have about 1 minute left in this segment, and I wish we had more time to talk, but if you could just touch a little bit on how these vulnerabilities were created in the first place through, things such as redlining and other practices and policies, because I think people need to understand now that there's more empathy in the world, because now more people are in the same position or similar positions to such as a Riverside community. Talk about, just really quickly in about 15 to 30 seconds, what some of those inequities are, but how they were created in the first place.
Well, and Logan, structural racism, I believe, is at the root cause of these health inequities. And, of course, that's been around, from the almost the beginning of time. And some of our policies, I think, how do you eradicate that? You eradicate it actually through policy. You eradicate it through your government resource allocation. And, we at Reach Riverside have been talking about this through the great work that you're doing as a purpose-built community. Those are solutions. Again, I believe, COVID-19 has really put a light on the need for us to address this structural racism through adopting policies that will eradicate, as well as resources, monetary resources, ensuring that everybody has a seat at that table who's impacted the most by these inequities, especially as we go towards the recovery of this COVID-19.
Rita, thank you so much for joining us. Thank you for being our first guest on our first installment of our virtual Lunch and Learn. Continue to fight, continue to be the voice for those that might not have as great of a voice as you. We appreciate all the work you do within our communities around the state. Thank you so much. And next up, Dr. Michele Schroeder-Pope from Nemours. This partnership with Prosperity Now has been everything for my personal growth as a leader. I often come into these opportunities, professional development, trainings, with a little bit of skepticism, because when you're leading an organization, first, you don't want to take time away from the organization to actually work on yourself, because sometimes you think you know a lot already, but you also don't think it's fair to the organization to remove yourself from the day-to-day activities. And the first 4-day training we had in DC, I was just amazed. I was calling back the people in my office like, we got to do this, we got to do that. And I think I just learned so much, but I also got a thirst for learning after being with Prosperity Now and its group, because I understand there's so much I don't know, and there's so much that I can continue to learn. So I think now I'm a lifelong learner as a leader. And I think in doing that, it refreshes me, it re-energizes me, and then I bring back those skill sets, those learnings to my organization so we can have the best impact possible. Good afternoon and welcome back. My name is Logan Herring. I am the CEO of what we like to call the Work Group, Warehouse, Reach, and Kingswood. What we do in the Riverside neighborhood really starts 74 years ago with the founding of Kingswood Community Center to be the heartbeat of the community. And about 3 years ago, we started an organization called Reach Riverside to lead a community revitalization, a holistic revitalization that really puts the community first. We are working in partnership with Purpose-Built Communities, which is a nonprofit out of Atlanta that helps community revitalizations around the country. There are currently 28 Purpose-Built communities, and we're the only one in the Northeast region. What it looks like physically is about 600 homes, a mixed income community, to replace the existing public housing community. But don't worry, the homes will be built on vacant land first, as to not have to displace anyone outside of the footprint of Riverside. In addition to the mixed income community, we are also scheduled to build a new state-of-the-art Kingswood Community Center to include a world-class early learning academy, a senior center, and a whole host of recreational and supportive services to be included with that community center. And last but not least, the warehouse, which is revolutionizing teen engagement, located on the south end of the Riverside Centers tract. At the warehouse, we have more than 140 partners, making sure that we provide all of the services and wraparound supports for our teens, not just in Riverside, but the entire city of Wilmington. So we call ourselves the Work Group once again because Warehouse, Reach, and Kingswood spell out work, and that's what we do every day with the community, for the community. Again, our second most star-studded special guest is Dr. Michele Shorter-Pope of Nemours. Michele, thank you for joining us today. It is a pleasure to have you.
It's good to hear from you, Logan. I'm glad you've been safe so far.
Yeah, definitely. We have our mask in the studio right now. I just took it off so you'd be able to understand me.
Okay.
So we just had Rita on, and she talked about a lot of the inequities that persist in low-income neighborhoods, particularly those communities of color, and the things that she is doing and helping with around the state and communities such as Riverside. And I'm sure you're aware we're doing the screenings of COVID and testing in partnership with Christiana Care. But Rita, what I really wanted to talk to you about are some of the struggles that you see in the community, and if you're willing to share anything that you've seen or experienced personally, because I really want people to understand the impact that it is having on our communities of color. So anything you feel comfortable sharing, please do so now.
Sure, absolutely. I think it's important for all of us to be transparent, because I think when you start to realize that this hits closer to home, it becomes real, right? And for my family, unfortunately, we lost and buried 3 people within a 2-week time frame. And still had someone in ICU. And I think one of the things that you and I have talked about, and other leaders in the community have talked about, is just the idealism that to practice social distancing or to acknowledge that COVID is real means that we're succumbing to fear and faith. And one of the things that I've been trying to impress upon people, even personally, outside of my profession, is to really talk about the fact that, you know, me exercising social distancing is not a lack of faith, because I do trust in Almighty God and that He will bring us out of this. But He also grants us free will and common sense, right? So we have to be cognizant of those things that are required to keep our families safe. And, you know, there are a lot of things that are happening that may make our communities more susceptible to COVID. We don't really know what that is yet. I'm not a clinician, so I can't really provide any additional information, because that's another issue that I think I have seen, which is there are a lot of assumptions that are out there. People in very prominent positions that have a voice in our community that have impressed upon our community some assumptive statements that may lead to some misinformation. But what we do know for a fact is that we are being affected at a disproportionate rate. And until we understand why, we need to do what's best to protect our families, so you aren't burying 3 people within 2 weeks. And that doesn't mean that you're afraid. It means that you're protecting your family and you're being smart about it until we have more information. So, you know, again, the only thing I would share is that we should start to really digest the fact that this isn't about faith or fear. It's really about keeping our families safe until we have more information, because there's just too much unknown out there. And until we have that information, we just have to be smart.
Well, Michele, thank you for being willing to share what's going on personally within your family and your loved ones. And I just want to say condolences to you. If there's anything we can do, you know, from our organizations, me personally, you know, you whatever you need, you just let us know. And man, that's a lot. That's a lot to deal with. And you know, can you talk a little bit about? And I hate to keep prying and keep asking you to, but I think if it saves someone else's life, you know, we have to be able to learn from it. So what has that experience been like, not being able to maybe bury your loved ones or say those final words in person? Anything, again, that you're willing or comfortable sharing, and whatever, I appreciate.
It's a challenge because you have someone in the hospital that you can't visit. Information is slow because you are trying to not necessarily overwhelm the one person or 2 people in the family who are delivering the information. So you have to kind of wait. You can't visit them. And there's never really an expectation that someone goes into the hospital to pass away. So you have to kind of just be patient and wait to see if it's going to go positive or negative, right? And I think that's where faith comes in. You still continue to pray and remain positive, but right now everything is just really unpredictable. And it's hard because you don't get to say those goodbyes. When you bury your family, there typically isn't a funeral. You go to the cemetery and there may be 10 of you, and you can't really comfort each other physically either. So you stand there, you may give air hugs, but you watch your family mourn. And some people are mourning at home by themselves, and they've been home alone, dealing with this for several weeks alone. So it's a different environment, and it's tough.
Yeah, I could say I could imagine, but I can't even imagine. What are some of the gaps? And I know you're familiar with our Riverside Relief Fund, and I'll talk about that in a little bit, where we are trying to stand in those gaps. But what are some of the gaps, maybe from the medical profession, or things that we could do better? Some solutions, just practical solutions that maybe we can do better as a community, or in the professional world that you've seen, where we could improve in some of these areas, so others don't have to feel or mourn with the losses that you and your family have had to endure.
I would say, personally, some of the gaps that I have seen are really just process oriented. When should you go to the hospital? And I think some things have changed because things change every day now. So for me, a lot of this happened shortly after the COVID outbreak occurred. At the time, early on, it was really inconsistent in regards to who could go to the hospital and who couldn't, when an ambulance would come get you. So I think, or I hope, that a lot of this has changed, and it's gotten easier for people to even get to a hospital to get tested. I see that testing sites are coming up, so that should be helpful, because back when my family was going through this, you could have someone who could have the symptoms for up to 7 days before they even got a test. And within 7 days, I mean, just imagine how many people can get infected. So I think as long as we continue to improve those processes, things will get better overall. But those were some of the gaps that I saw immediately. But again, this was early April, late March.
Thank you. So I've been watching CNN around the clock and just following all of the interviews and press conferences and recommendations. And I remember it was maybe 3 or 4 weeks ago, I recall someone saying, what success would look like at the end of this, and it'll look like you'll question yourself if we did the right thing. And that means just nothing happens. And we see a lot of nothing happening. You see the numbers are increasing. I think we're still haven't hit our peak in Delaware, but everyone's getting antsy to get out of the house. So what are some advice that you might give us all, because we might not see the direct impact as you have seen within your family. We might not know anyone that have had it. So what can you give us as advice personally to really take this seriously? Because, if not hearing your story isn't enough, some people don't believe it until they actually see it and feel it. So I don't want anyone to have to go through what you've gone through. So any advice you could give us along those lines?
And I appreciate that. I think my family, thankfully, we're a close family, so we've been able to support each other the best that we can. But I think if it's not close to home, some of the advice that I would give is just to take the same precautions you would if it wasn't something that was a pandemic, right? All of us don't get in major car accidents, which is a completely different example, but you still take the same precaution, right? You put on your seatbelt because you don't want to get injured if you get in a car accident. And we, over time, have gotten data about car accidents and what can happen. And there's a lot of things that you can, reflect on historically. But in an environment where you don't know anything about the disease, if someone's giving you tools that would be metaphorically like a seatbelt, just do it, right? You don't have to get in a car accident to know that you need to put on your seatbelt. So if you want to make sure that you are protecting your friends, your family, yourself, I would say that, just to practice precautionary measures is always better than trying to react afterwards, because usually by the time that you react, it's too late. If you start developing symptoms because you did not take the appropriate measures, it's too late. So practice ahead of time, because if even not for yourself to be responsible, just think about the fact that you could die in the hospital by yourself and your family will not be able to say goodbye to you. And that's not something that, you would want to go through or have any of your loved ones go through. And unfortunately, it may not even be your own actions that put you in a position where you're being exposed. So that's why you really have to protect yourself, because I could be going to the grocery store and not taking the correct precautions, or the person next to me could not be taking the correct precautions, and you end up sick. So it is now the time to be more cautious than not cautious at all until we start to see the numbers improve.
Thank you, Michele, and thank you for joining us. And I think what I gather, and I hear you saying, and I appreciate you simplifying it for us and creating that analogy about putting on your seatbelt. I think we've gotten that message across, but it's taken a long time, and we can't afford to take that much time with these precautions, because everyone is susceptible to this. Everyone is vulnerable. There are so many unknowns. So what I hear from you, and what I want to impress upon everyone watching this, is put your seatbelt on now. Take the precautions now. Stay in the house. If you do have to go out, put your mask on. Follow the recommendations. There are so many unknowns, and we are in this together. And if one person doesn't do it, it makes us all vulnerable. So again, thank you for this. Right now, I'm going to, just segue this conversation, because we talked a lot about the issues, but I think you and I began to segue into some of the solutions and some of the preventative measures that we can take. So one solution we've provided within the work group Warehouse Reach in Kingswood is our Riverside Relief Fund, where we are going to be providing direct cash disbursements to all of the households in the Riverside housing community adjacent to Kingswood. That's about 300 households where we're going to be providing $250 cash per month, given we are successful with our fundraising campaign. In addition to providing that cash assistance in the neighborhood, we're also going to be providing screening and testing at Kingswood Tuesdays and Thursdays, 10 a.m. to 1 p.m., to make sure that we eliminate that barrier to accessing health. There's a whole host of other activities that we're going to be providing in terms of this initiative. Eliminating the digital divide in Riverside. We're providing technology, Wi-Fi, virtual learning. We're converting the warehouse to virtual learning programming. Those same activities for our early learning, providing food access, delivering food to our seniors, making sure our youth have food in the community, and anything else we can do to literally stand in the gap with our community and do what is needed to help get our community through this. We recently received some support towards our fund from DJ Jazzy Jeff, as he dedicated his set online, his virtual set that he's been doing, where he, has a worldwide base of supporters, and he dedicated his set to Reach Riverside. So we want people to support. I know everyone is in a different economic situation as far as what they might have as disposable income, but remember, if you're in a situation, think of how bad the situation could be with those that were vulnerable before this pandemic. So for more information, visit our website, reachriverside.org/donate. And again, reachriverside.org. And we would love any support that you could offer us and our community. Thank you all for joining our virtual Lunch and Learn, and stay tuned for the next one. And we'll have much more to offer with incoming installments as we go forward in this pandemic. Make sure to take care of yourself and those around you, and stay safe and wear your seatbelt.